So shingles is caused by a virus called varicella zoster, the same virus that causes chickenpox. So back prior to 1980, about 90% or 99% of people had chickenpox. So everyone who's had chickenpox in their lifetime is at risk for shingles because the virus stays around in the body, especially in the nerve endings and nerve roots, and it can be triggered at any time in your lifetime. And it can be triggered multiple times. Hence, when you see shingles, you see it along the course of a nerve. So usually it's like a strip of rash that you get. Initially starts off as just itching, burning skin, redness of the skin. And then after that, the rash looks almost similar to chickenpox. Whereas in chickenpox, you have rash everywhere, all over the body. Shingles is very focal. The shingles, usually the rash lasts about 5 to 7 days. The minute you notice blisters or increased redness or pain and a rash, notify your doctors because we can use antivirals. There's 2 different antivirals which are the most commonly used. It's valacyclovir and acyclovir. We can use that, and the way we pick is based on what is covered by your insurance. Both are very effective. And just topical treatments with calamine lotion, to help with the discomfort. The most common complication with shingles is neuritis. And what do I mean by that? The nerve endings are inflamed, irritated, so you can have the severe pain that comes with shingles. And it can last. Some people are lucky enough to have it just for the week, and it goes away after the rash scabs up. But some can have it for a very long time. The risk of having this post-shingles or post-herpetic neuritis and neuralgia goes up as we get older. And the risk of having more disseminated and extensive shingles goes up as we get older, especially when it impacts all your facial nerves. And it usually travels, when it's the facial nerves, it can cause more other complications like visual loss because, the nerve endings that supply the cornea, the eyes, that get impacted, and you can have corneal, abrasion, inflammations. And that causes visual discrepancies and visual loss. Sometimes it can also be severe enough to cause brain encephalitis, confusion, and that's when you have to be in the hospital and be admitted for it. That is uncommon. Does it happen? Absolutely, but the most common is what we see on a day-to-day basis where it's more focal. The key to prevent shingles is to make sure you get the shingles vaccine. So the CDC recommends that anybody 50 years and older should get the new vaccine, which came out 10 years ago, which is called Shingles. It is a 2-dose vaccine. You get it, the first dose and the second dose is in 1 to 2 months after that. And that's it, you're done with the 2 doses. Shingles has been shown to reduce your risk of developing shingles or recurrence of shingles and decreasing the complication of neuritis by about 90%, as opposed to the prior vaccine before Shingles was Zostavax. So CDC also recommends that anybody who's received Zostavax in the past should again go ahead and get Shingles because of its efficiency and efficacy in reducing the recurrence rate. Can you get shingles again after 1 episode? You absolutely can, because usually, like I said, the virus lives in the nerve endings, so we don't know when it triggers. So yes, you can, but with the vaccination, even if you get it, the intensity is less, and that's the whole purpose of the vaccine. Who's at risk for developing shingles? Again, anybody who's had chickenpox can get shingles. Those who have never had chickenpox during their childhood or even later will not get shingles, but at high risk of when they're exposed to people with shingles and with the liquids, the active scabs or active infection, when they get infected, they actually get chickenpox, not shingles. So which is why we say that when you have shingles, please make sure you're well covered, so you're not spreading the virus. Don't be around pregnant women, don't be around little babies, because it can, in pregnant women, it actually causes, neurologic changes in the fetus and the babies, and we want to avoid all of that. The way you also can, increase your risk is diabetics. Anything that increases your risk of immunosuppression. People on chemotherapy, cancers, they're all at higher risk of developing or getting shingles. So if you have shingles and you have somebody in the family or you're around people with these immunosuppressive disorders, please be careful.